Hi, let me just get situated here. Okay, okay, headset's working, I hope, video on, and we are live. So, hello everyone, I'm Jean Chung again, here to talk more about menopause myths because there are so many and they persist, and the best thing to do is talk about it more, put some frameworks around it, give perspective. So here we are, Menopause Mythbusters number 3, and we're talking about treatments. So remember when we kicked off the whole menopause myths, there were three main categories that were really logical. The first was around when it would happen. The second was around what's going to happen, like what are the symptoms, and that was predominantly talk about hot flash because it is the hallmark menopause symptom. And now we're in the third chunk, which is then what do you do about it? And the prevalent myths, unanswered questions are around HRT, hormone replacement therapy. So today I want to give some perspective on hormone replacement therapy, the myths, and give us all kind of things to consider and to keep in mind while we're thinking about HRT. So first I'll start out by saying, I'm not a doctor. I'm not here to offer medical advice regarding whether or not anyone should take HRT. What I really want to do is just offer a different perspective, pull pieces of information together so that there's a little bit more foundational understanding about HRT. So let's begin. Myths around HRT. So we talked about the prevalence of questions around HRT itself, and that makes sense. If you think about the history and context of menopause and how we deal with menopause in the modern era. First, menopause has been medicalized. Since the 1950s, since synthetic estrogen has been given to women as they age to deal with menopause-related symptoms, it has been medicalized as a disease state, a deficiency syndrome which needs to be fixed like a heart attack. And that perspective really drives what conventional medicine focuses on, the understanding of really what it is, and looking at it from a band-aid perspective or an aspirin perspective, and not looking at the underlying causes, the fluctuations of hormones, but just how to deal with all the symptoms. And from my point of view, it is medicalized and it's treated like a disease because of the white male patriarchy that has infused our medical system, that's dismissed women's health issues, particularly as women age. A little piece of history that I wanted to give you, which might be a bit polarizing, but is one of those things, like in other sessions I've mentioned, really just pissed me off, is thinking about this. So synthetic estrogen was kind of discovered in the late 40s, early 50s, started to be prescribed for women as they age with menopause-related symptoms in the 50s. Two things to point out. One, the doctor who started this therapy also coined the term forever feminine. No, feminine forever, which is the polarizing part. So because I think, when we think about femininity, current femininity is very narrow in like what we hold up as the ideal feminine. And anyone listening to this and anyone interested in this topic would immediately, in my view, be like, call bullshit on it. Or there's so many different forms of being female and femininity. And the idea that you are, as a woman, no longer feminine if you're not just, if your bloodstream's not full of estrogen, is kind of crap and archaic in my view. So, and here's where the male patriarchy comes into play, is they were just giving estrogen to women because they decided that women needed, because things like your husband's going to leave you if you're not sexy and youthful, that kind of crap. And the other thing is clinical trials on estrogen and progesterone hormone replacement therapy weren't conducted until the 1990s. So there were male doctors, predominantly in the 50s, 60s, 70s, who were prescribing estrogen to women without any friggin' clinical trials. So setting that aside, that I think is why there's so much conversation around HRT, because it's been the history of how we deal with menopause symptoms. So that's what we're looking at, breaking down HRT. So next, let's talk about what it actually is. So HRT is hormone replacement therapy. There are a couple of versions of it. So one is you're taking just estrogen, and one is taking a combination of estrogen and progesterone. And research is a little bit all over the place, so it's hard to say conclusively what is good for you or what's not good for you or what is good for women in general. But those are the types of hormone replacement therapy. And the methods which you take it, so you can take it orally, you can take it transdermally, and you can take it locally. So for example, one treatment for natural hormone replacement therapy is using local estrogen, so in a pill or ring form, inserted vaginally to deal with the vaginal tissues. And when estrogen is fluctuating or reducing, it has an impact on the tone of the vaginal muscles. So by putting estrogen locally, it affects the tone without going into the bloodstream. Whereas if you take it orally, it goes into your bloodstream. It has to be processed to the liver in order to get to the body where the body needs it. So those are kind of two differences. The other thing I'll talk about, just share, is for transdermal. So you can have a transdermal patch of estrogen, similar to like a Nicorette patch. So there are different doses that you can have through the skin. And things like progesterone cream and estrogen creams you can also just rub on as needed. The thing I will point about transdermal, which I think is pretty dope actually, is when you take oral estrogen or anything oral, even ibuprofen, is they formulate it so there's enough of the active ingredient to withstand being processed by the liver so that then can be pushed through the body. So that means it's actually a fairly high dose and formulated away, again, to deal with metabolism through the liver. The transdermal, the research that I've seen regarding transdermal is so cool because you can have a very low dose. It goes through the skin. It gets into the bloodstream without having to go through the liver. So it isn't broken down, so you don't need so much. And what happens is it kind of stays at a steady level, a lower level in your blood, which is more closer to emulating actual hormones in your blood than it is when you take oral. So when you take oral, after it goes through your liver, the levels get really high and then drop away. So on average, it might be good, but the experience is there's a lot of estrogen and then there's none. Whereas transdermal kind of gives you a high level and floats you along for a little longer, which in my view just logically makes more sense and seems a better efficacy. So that's what we're looking in terms of structure, right? You have estrogen and progesterone, oral, local, transdermal. One of the things that I think about in looking at all of the myths and all the questions around HRT and is it good for me? It's the only solution. Is it risky? Is we want to deal with our symptoms, right? So our symptoms can be intense, and they're legit symptoms, and we have very full, complex, wonderful lives to lead, and we are kind of too busy sometimes to deal with all of these things. And I look at you from the doctor's perspective. They're really busy. They see you for 10 minutes and like, oh, you're having issues. Here's some pills. Roll with it. My concern about that is because of the history of estrogen and progesterone hormone replacement therapy, because of the history of women being dismissed for showing up with medical issues and health issues, women are given painkillers in a hospitalized setting, 16% less than men. So doctors actually don't believe that women are in pain, and we have to keep pushing and pushing for that. So I think we've been so used to kind of dismissing our own health and well-being that we kind of just give it up. And I urge all of us to think about, we really need to take our symptoms seriously, our indicators of health seriously, that we have a commitment to our self-awareness and how our body changes, the symptom levels, how they manifest, and how we feel, and if we're consistent about it, then we're able to make informed decisions, to pull information around HRT into the data set so we can decide whether or not if we have enough information to make the right choice for us. So that's one thing. Suffering sucks, symptoms are real, and we want solutions. How do we choose solutions, right? We have HRT in front of us. Every doctor is going to talk about HRT, and it is, I think, still quite risky. So here's the thing. When I look at this, it's HRT is can be an easy out for symptom relief. The perspective with HRT that I have come up with, I think, is an interesting spin. I looked at HRT as birth control for old ladies. So you look at birth control for teenage girls who can't deal with the fluctuations so hard. They just chuck light birth control into them and just modulate them, kind of flatline them in a way. And I look at that the same with HRT for older ladies. I haven't done a comparison between the dosages and the types of synthetic hormones that are being offered in those two products. My guess is they're going to be really friggin' similar. But the challenge with both of those scenarios is that it masks really what goes on. And that's where the wisdom and the insight is to understand individually how things change, how my moods modulate, how my weight is changing, how my sleep is changing, how my periods may be changing. That's what's, I think, really dangerous about widespread HRT use. It's too easy, and it's too easy to tune out. Monica has a question. I've just got off birth control at 24 years, at 51, got off in January, started having hot flashes from low estrogen. What do I do about it? Oh, yeah. So, Monica, like just from my perspective and the research that I've pulled together, is coming off birth control right now, your body is going to you are going to see what your body's been doing underneath the birth control. And so you're paying attention to that. With hot flashes, right? Hot flashes are associated in the research I've seen with fluctuations in estrogen. So as it drops, and now that you're 51, your estrogen is kind of going all over the place. So you'll see hot flashes can occur because estrogen levels are dropping. Muscle aches, I don't know too much about muscle aches in menopause, so I won't say anything about that. So going back to why HRT, why I personally would tend not to move away from hormone replacement therapy. I'll tell you this cool story. So a woman wrote a book called This Is Your Brain on Birth Control. And I have it in my list. I have it. I haven't started reading it yet, but I'm really excited to. She was being interviewed on NPR, and she talked about the fact that when you're in your estrogen part of the cycle and progesterone part of your cycle, you're like different people and you're feeling differently, and you're energized or you're nesting and you're feeling sexy and energized and active, or you're feeling kind of emotional and slowed down. And she had this suggestion that it impairs your decision making and it impairs how you connect with the people, your smell, right? And she said, if you are engaged to someone and you've been on birth control for a really long time, you've met, you should come off birth control and assess how you feel with this person not being on birth control, because your own fluctuations will tell you something, which I think is just so fascinating. I think another indication why we need to be really in tune with the fluctuations in our hormones. The other thing, which I will share, and I don't know if many women may know this, is called the sniff test. And another female doctor had been studying female hormones through the menstrual cycle, and there's a test. They had a whole bunch of dudes wear a clean white t-shirt for a couple days, no showering, put them in Ziploc bags, send them to a lab. In the lab, then random women would come in and smell the shirts. And so they're like this guy, don't like this guy, don't like this guy, like this guy. But they tested the smells while they're in their estrogen period of the cycle and in their progesterone, so pre-ovulation and post. And they had different desires. So one woman during her estrogen cycle, with part of the cycle, would like this smell, but later not like this smell, which I think is amazing. So I just wanted to share that because there's such power in the cycle of our hormone fluctuations. Okay, so thinking about HRT, so I wanted to pose this question of why you would consider it. So one, symptom relief, great. The other is maybe you're not having a lot of symptoms and you're looking at long-term health effects. So there are two kind of decision points, one decision tree regarding using HRT. So HRT has shown very quick efficacy on symptom relief, hot flash, mood, insomnia, and also has shown positive indications for heart health and bone health. There's the contraindications are increased risk of certain types of breast cancer and certain types of deep vein thrombosis, which is a type of stroke. So keeping that all in mind, right? Looking at are you looking at short-term symptom relief? Are you looking for long-term health protections? That's an important factor. And the other thing I would add is once menopause hits, it's a multivariate problem. So there are things like estrogen and hormone levels fluctuating within us, which are creating feelings of anxiety or feelings of depression. And then there's things external to us that cause anxiety and depression and sleeplessness. So it's very difficult to kind of pull the two together. And I would suggest that it's important to have a strong foundation, meaning we're healthy in other ways. So our weight is down, our eating's good, we're pooping well, we're sweating often, we're moving our bones. So one of the things I've seen, I'm kind of like babbling on like a little bit off topic, in a lot of these Facebook menopause forums, and all of a sudden will say like, I have plantar fasciitis like crazy, my shoulders hurt like mad, and my joints are killing me. The question is, how much has that body been moving before these symptoms arose? So if you're fairly active, and then there's plantar fasciitis, which is the pain in the bottom of your foot, the arch of the foot, like maybe it makes sense because you haven't been moving and it's not necessarily related to menopause. So that's the kind of clarity and insight and attention that women have to pay to their symptoms, and then create a basis, the foundation that is clear and strong and balanced, so that when there are changes, we can identify it's one thing or the other. I was talking to a naturopath or a health coach in New Zealand, and she said her first point of advice is to go keto or paleo for 2 weeks and 3 weeks and see how things just modulate and come down. The body is always looking for homeostasis, so it's trying to always reading signals in and out to find balance. And when one system goes out of whack, boom, there's where symptoms can manifest. So that's the decision point. You're having symptoms, what are you going to do? Is it a short-term thing that you want to deal with? Is it health, long-term health advantages that you want to consider? And looking at all of those things. What I wanted to add here is a little clarity on the current set of research around risks in HRT. So there was the big study in the 1990s that said women had kind of increased risk of cancer and heart attack, and everyone was like, oh shit, like stop taking it. There are two things now, which is now 30 years later. One is they were testing women in their 60s who were well post-menopause, their new normal. And at that point, they're concluding that once the estrogen's kind of gone away for a while, adding estrogen is risky. There's a lot of research, some research now that is indicating as the hormones start to change in your 40s and early 50s, adding estrogen and progesterone, in certain cases you choose estrogen only, that it's helping create like a soft landing, right? So the erratic nature of the change, kind of keeping some steady level of these hormones around can be beneficial to symptom relief and long-term health. The question then is, when do you start? How long do you take it, right? How do you know? We don't have enough data because this research is just coming out. We also don't have good diagnostics to figure out if in fact this is the right time for you to start and what the level is and how long you should take it. And if you're on it, then test frequently to see if you should still be on it. If we modulate over time as your body's naturally going to its new normal, can we also taper the HRT, follow that along to again create that soft landing? So that's kind of the HRT side. And you're thinking about symptoms, what else to do, there's alternative natural remedies. And what I'll add here, I'm going a little bit over, is it's important for me, this is my perspective. HRT is a very modern occurrence, and it's couched in the hyper medicalized world of menopause. Like, this is the solution, adding synthetic hormones. When in fact, there have been old ladies on this planet for a very long time who've passed their reproductive years and are doing their thing, right? Many cultures who've been supporting that transition and issues with menstrual health and aging with plant remedies. And I put a lot of weight and value into this historic wisdom around using plants. Where we are today is they're getting more popular, there's more information about them, and there's increasing amount of research. The research is nearly not as numerous as research around HRT, because that's how the medical and research institutes are oriented, but it's there. And I encourage you to look at things for hormonal balance. If you're still having a period, herbs like chasteberry, otherwise known as vitex, for post-menopause, where later perimenopause and post-menopause, where estrogen is going down, you're looking at phytoestrogens in soy, flaxseed, red clover, and they're hard to kind of figure out. So you're going to have to read and keep reading to understand how they work, what they're good for, what dose to use. So I'm sorry that I don't have conclusive, very discrete information on what to use and how much, but hopefully this gave you a framework on how to think about HRT, how to think about symptom relief and long-term benefit, some distinctions on HRT, local, topical, oral, estrogen plus estrogen and progesterone, and understanding for yourself what's the right thing for you, and pointing towards more self-awareness, more tracking, more attention to how your body's changing. So that's it, busting some myths around HRT, and we'll leave it there for today. Thanks. Bye.